everyone, Eileen Bayer the Fam here. Welcome to the last installment on bipolar disorder mini-series. Today we're going to finish up the management of bipolar disorder and everything that's involved with it. And then next week we will be starting a new series on epilepsy. So let's get going. Okay, this is part 2. Yesterday was part 1 of the management. Today is part 2. And we're going to start with the medication part of managing bipolar syndrome. And it's going to go in detail what the medications are. Please forgive me if I have a hard time pronouncing some of them. But we're going to go over each of the different medications, what they're used for, their effectiveness, and then I'm going to have a little discussion at the end on some things that I know some people do, but we're going to go over this, so let's get started. A number of medications are used to treat bipolar disorder. As you can see, these are like some of the different medications used. When I go through this, I'm not going to be able to tell you which one is what because I do not know. But these are the medications, some of the ones that they use for bipolar disorder. Okay? The medication with the best evidence is lithium, which is an effective treatment for acute manic episodes. It prevents relapses in bipolar depression. Lithium also reduces the risk of suicides and self-harm and death in people with bipolar disorder. Now, I do know there are some side effects to lithium. I'm not going to go into any of the side effects. But a lot of medications, as you know, just even some antibiotics will have side effects. And just to let you know, and like I said, what one of these is the lithium, I could not tell you because I do not know. But lithium is one that they do use a lot. It is unclear if ketamine, which is a common general anesthetic used in surgery, is useful in bipolar mood. Okay, so the main one that they use is lithium, and we're going to go into some mood stabilizers, and I'm going to discuss what they are with you, and give you that information there. Lithium and the anticonvulsants carbamazepine, lamotrigine, and valproic acid are used as mood stabilizers to treat bipolar disorder. These mood stabilizers are used for long-term mood stabilization, but have not demonstrated the ability to quickly treat acute bipolar depression. Lithium is preferred for long-term mood stabilization. So you can see the lithium they use for to stabilize the mood so they don't go into their manic moods as often compared to the other medications. And carbamazepine effectively treats manic episodes with some evidence. It has greater benefits in rapid cycling bipolar disorder or those with rare psychotic symptoms or a more schizophrenic clinical picture. It is less in preventing relapse than lithium or valproate. Valproate has become a commonly prescribed treatment and effectively treats manic episodes. Lamotrigine has some efficacy in treating bipolar depression, and this benefit is greatest in more severe depression. It also has been shown to have some benefit in bipolar disorder relapses. Though there are concerns about the studies done, and it is not for benefit in rapid bipolar, rapid treatment. When it goes into the rapid cycling, it's not that effective. Antipsychotic medications, on the other hand, are effective for short-term treatment of bipolar manic episodes and appear to be superior to lithium and anticonvulsants for that purpose. Atypical antipsychotics are also indicated for bipolar depression, refractory to treatment with stabilizers, and olanzapine is effective in preventing relapses, although the supporting evidence is weaker than the evidence for lithium. Now, antidepressants are not recommended at all unless they go with something else. Just regular antidepressants, the clinicians do not recommend using them by themselves to solve the problem. Atypical antipsychotic medications are preferred over antidepressants and augment the effects of mood stabilizers due to the lack of efficacy of antidepressants in bipolar disorder. Now, what I want to go over before we do anything else, there are people out there that do manage their bipolar disorders with no medication. And there are some that do have to have it. I would suggest, don't judge somebody because you don't know their bipolar disorder. So if you know somebody and they say they're not medicated, don't judge them until you know exactly how their bipolar disorder is. Remember, there's 3 subtypes of it. There's type 1, which is the most severe. Type 2, which is a little less severe than type 1. And type 3, which is that word that I have a hard time saying, so I'm just going to keep with type 3. So they may have type 3 where they don't need medication. Or they just might be, a low type 2. But the majority of people that have bipolar are on medication. A lot of them don't like taking the medication for it because of the bad side effects that some of these drugs have. I'm not going to go into managing it without medication. That's totally up to the individual themselves. And remember, they don't need to be judged just because they're not taking medication for it. That's why you need to always see with the heart and not the eyes, so you can understand, ask questions to them. If you're a parent that has bipolar syndrome and you say, there's days that you cannot function and your kids understand, I understand that part and that's fine, but think, if an emergency and you cannot function and your children need you. Please take all these factors into effect before you make any decisions. For those that know people with bipolar or don't know anything about it, I do recommend that you follow this series from the beginning all the way to the end to get the full understanding of this disorder. And remember, never ever judge somebody by a cover, because it's just like a book. You can look at a book, look at the cover of it and say, oh, this looks like it's going to be an awesome book, and then you start reading and it's like, oh, this book is so boring. Or you could, open the book and read the introduction and the foreword and start reading the book and be one of them books you just can't put down. So you never judge anything by the cover, and people are the same way. That's why you need to see with the heart, because when you see with your heart and not your eyes, when you see with your eyes, you're looking at the cover of a person, the outside, and you're making prejudgments on that. When you see with your heart, you're going deep into that person. You're trying to understand them as much as possible. You're being as loving as you can. You're seeing them for who they are and not for what you want them to be. You're not judging them by what they wear, the way they walk, the way they look, the way they talk, or anything outwardly like that. Your judgments are primarily going to be on the inside, on who they are on the inside, because that's what matters. What you see here does not matter. This is a shell. What matters is what's here on the inside. That's the important thing, is what's here on the inside. So you could meet somebody that has bipolar disorder, and if it's being treated or whatever, they could be the most sweetest person you ever knew. Some may have it more severe where you don't get to see that. Please keep in mind, this is a disorder that affects the brain, and that's why you need to go back and look at that video where I show the difference between a normal brain and a brain of somebody that has bipolar disorder. You can see a major difference. So that person should not be judged because what you see with no understanding on what's going on. Once you understand what's going on, you have a better understanding. Have empathy for them, if nothing. But, they deserve the same love, understanding that everyone deserves. Okay? I hope you all enjoyed this series. I enjoyed bringing it to you. I hoped I helped at least one person with this series. I hope I opened some eyes to what bipolar disorder is. And, in hopes that this could be a better place, because since I've done it, I've had a lot of people, say, yes, I know what this is like, or thank you for bringing this up. And, my heart to theirs. I love them for who they are. They are my YouTube family. Whether they have a mental disorder, a physical disorder, or no disorder at all. We're all uniquely made, each and every one of us. We've all been put here for one reason, to love one another. Okay? We were not created to be by ourselves. People were created to be with people. That's, like I said before, that's why the song, "One is the loneliest number," is so true. Because if you're by yourself, there's nobody. In safety, two or more. In praying, two or more. There's so many cases where it shows that we're meant to be with other people. But we cannot be with other people if we're passing judgment prematurely. It's not even our place to judge at all. This world will be a much better place if we accept everybody for who they are, as they are. I love each and every one of you just for being you. I don't ask you to change in any way, because I love you for you. I know what it's like to be prejudged. I know what it's like to feel like you don't belong. It's not a nice feeling for anybody to go through. And I want you to know You out there, yes, you matter to me. Okay? You are important to me. And I love you for you. So to remember, always to see with your heart and not your eyes. Because what the eye sees is not important. It's what the heart sees that matters. So until tomorrow, I love you, and I will see you, not tomorrow, I will see you Monday with the next episode on epilepsy. Bye!